And like Fatima's soapbox, this is obviously one of my passion places. So I'm going to work really hard to not talk too long. Currently at Therapy Partners Group, we have 3 accredited residency programs in sports, women's health, and orthopedics. And we have 2 fellowship programs. Our Upper Extremity Athlete Fellowship Program is ABPT RFE accredited with the Cincinnati Reds. And our Division I Athlete Fellowship is in partnership with the University of Arizona in Tucson. Our residencies are currently housed in each of these locations that are here. And our goal is to continue to expand to other brand partners as we have the opportunity and appropriate faculty in different areas. So this list should continue to expand. So what does it take to get into a residency? Here's what it takes. It takes an that you're eligible for PT licensure in the state that you want to be practicing in. You need to apply in October with the RFPTCAS application. That PTCAS is very similar to the one that you used to apply to PT school, and so it should be fairly easy for you to navigate. And for our sports residency, you have to be ERA certified. That is a requirement for the SCS, and so we ask for that to be completed prior to residency. Other than that, what you need to have to be an incredible resident is a desire to learn and to shape your practice based on the ways that other people practice. And so coming in and saying, hey, I want to learn everything I possibly can in the shortest amount of time possible is exactly the way that you get to be a great resident. In addition to myself, Jen Allen and Ethan Pastor helped oversee our residency teams. And our residency faculty are board certified specialists in the specialty area. They are experts with many years of clinical experience, and residencies provide an opportunity for both in-house mentoring and education. That specifically looks like over the course of 15 months, all of our residencies begin in August. So this year of August of 2024, a resident will begin, and that residency will continue through November of 2025. What that allows us is to take 15 months to pour as much information into your brain as possible. And that information is not just about clinical expertise. We'll talk about some of the other things that we cover in residency as well. After that, we ask you to stay and work with Therapy Partners Group for the next 15 months, which takes you from December of 2025 through March of 2027. That affords us the ability to do a couple of things. One, it allows us to pay for your specialty certification exam. 2, it allows you to work on faculty in our residency programs or in the new graduate success program to allow you to not just be a learner, but also to become a teacher and a mentor so that you're able to step out from this program and into a place where you are a leader in the field. The American Board of Physical Therapy Residency and Fellowship Education, or ABPT RFE, requires a few minimum standards to maintain accreditation. That includes 1,500 patient care hours, 300 educational hours, and at least 150 mentoring hours. Over the past several years, our residents have worked at least 1,500 patient care hours, but they have also done often more than 400 educational hours, and often many more than 150 mentoring hours as well. So we far exceed the minimum standards required by the accreditation board. And in residency, we're not just talking about the knowledge for practice. That's can you do the things you need to do to get your patients better? We also are training in inquiry skills. Do you know how to ask the right questions to get to the right answers? And clinical skills. Can you do the hands-on things that you need to do to manage your patients? And clinical reasoning. Are you able to make the decisions that you need to make to get to the right diagnosis, and then from that right diagnosis, figure out what the next steps are, and then assess how well that plan of care is working to get your patient better? Systems-based practice talks about making sure that you can work within the system that you're in. So with it for Therapy Partners Group, that means, do you know how to work with the schedule that you are given? Make sure that you're utilizing your support staff and your physical therapist assistants to the best of their ability to make sure that your patients get the best care. For communication, that means both within the company as well as without. Are you able to talk to doctors and other medical providers to make sure that you are coordinating care for your patients? And then professionalism, that thing that started as a student that made you incredibly successful. Our goal is that you continue to build those skills as a part of your residency education. So what does a week of residency education look like? For orthopedic and pelvic physical therapists, you are in the clinic for 36 hours a week. For sports physical therapists, it's 32 hours a week. And that's because in addition to clinical experience with sports PTs, you also have a long list of on-field exposure that you need to have as well. In addition to clinical time, there's also somewhere between 4 and 20 hours a week of didactic time. And that includes things like MedBridge and continuing education courses, live modules and labs, research articles, article reviews, and teaching. And that sounds like a lot of fun, I'm sure. But what that looks like is this. It looks like giving presentations about things that you're passionate about. It looks like standing on the sidelines of sporting events. It looks like presenting at national conferences, and sometimes it looks like cuddling fun puppies. It looks like teaching other people how to tape appropriately. It looks like practicing on each other. It looks like learning in lectures, and it looks like trying things out. And it even looks like going to CSM. Sometimes it looks like having a whole bunch of fun and doing some arts and crafts, or practicing manual skills with each other, or listening to some really engaging lectures. So why is residency education beneficial? I could come up with a list that is much longer than this, but what residency education gives you is a guarantee that you have access to a robust and specialized clinical faculty. Gives you opportunities to teach and do research. And truly, it is a fast track to board certification. So if you know there's an area of practice that you want to specialize in, residency education gets you there faster than if you graduate and just start working there on your own. It gives you the ability to enhance your examination, diagnosis, and prognosis skills, and improves patient outcomes. The other thing that's interesting, if you look at the APTA workforce report, for those who specialize early in their career, they have found that they have a higher earning potential. So if what you're looking for is how to maximize the financial benefit of being a PT, it's definitely something to consider.